Yo, what's happening, Captain? It's your boy JW, just hanging out here with my man Lenny Roberts over here at Summit Spine and Wellness. I'm going to ask him a couple questions here. He's going to tell us what he knows from his chiropractic standpoint. All right? So, Lenny, thank you very much for meeting with me today. That's awesome.
Pleasure. Always good to see you.
It's my dude. So, first of all, Lenny, can you tell me a little bit about ART?
Sure. ART stands for Active Release Technique, and it's become the gold standard in soft tissue mobilization. And one of the biggest challenges that we see in our society today is people holding these things, looking down at a laptop, a computer, a cell phone, and they build up a ton of tension from that head coming forward posture. And when that head shifts forward, the average human head weighs about 12 pounds. Anywhere from 10 to 15 pounds, about 12 pounds. So as that head shifts forward, that causes all the musculature up and through here. So a lot of people carry a ton of stress and tension up and through here, and that's from that body's compensation from that head coming forward posture. So what active release is designed to do is work on elongating restricted soft tissue and getting that to move and glide and function properly again. It can be used for a variety of different things, from repetitive stress injuries, carpal tunnel, to plantar fasciitis, to sciatica. It can be real beneficial. One of the main areas we work on is the hip flexors and that internal rotation of the shoulders up and through here as well. So variety, there's 500 and some different protocols, and we've all been trained in active release technique, and it's a big part of what we do.
Okay, so ART stands for Active Release Technique, not art, not painting. They really do some active releases here. All right, so kind of going off of your answer for ART, you were talking about hip flexors. Would you say that's like really one of the I guess points that really gets people? I guess that's the word that I'm looking for. You probably could explain a little bit more.
Yeah, the hip flexors are the two main muscles that form the hip flexors, the psoas and the iliacus.
Okay.
And when we spend so much time as a society sitting, and again we throw the computers and the cell phones in front of us, it really causes an imbalance in our mechanics in our body. We're not designed as human beings to sit, let alone for 8, 10, 12 hours a day, and then sit with really crappy posture. So that the hip flexors can take a big load on that. And one of the most common things we see with that is when people sit, they'll have their heels behind their knees. So they'll sit like this. So the heels are behind the knees. That's going to engage the hip flexors. So it's going to throw off your center of gravity. So then typically they sit like this. So it's causing a lot of compression and tension on the spine, especially the lower part of the spine, the lumbar spine. The hip flexor actually attaches up into the front of the bones in our lower back. So disc injuries, low back pain, all that stuff. And people often, when they go, have a hard time getting up from a seated position.
I've had that.
Hip flexors is really, really restricted. And the ART, in conjunction with what we do from a spinal adjusting and the posture analysis stuff, all works together really well.
All right, cool. I know you're a busy dude, so I got one more question for you. What made you decide to get into chiropractic?
Short story I'll give you, Jared, just because it can get lengthy. I had wanted to be an orthopedic surgeon when I was in college, and loved sports and orthopedics in the body. But I had a pretty routine knee procedure, and about 2 weeks after that procedure, I developed a staph infection. So it wasn't like anybody, no negligence or anything, just stuff happens sometimes. And I had a staph infection, and I wound up being on IV antibiotics for like 6 weeks and wheelchair for 6 weeks, and just really changed my path on what I wanted to do. That stuff happens.
Yeah, absolutely.
And kind of right place, right time. One of my roommates in college, his best friend was coming down, knew he wanted to be a chiropractor since he was like 12 years old. And he talked to me about chiropractic, and that conversation just shifted my path, my trajectory. And here we are, about 20 years later. It's 16 years here, but school and everything's been about 20 years ago.
That's so awesome, Lenny. So that's Lenny Roberts in a nutshell. He's done some work with the 76ers. He's now working with Temple. He's their team chiropractor, and he obviously runs this awesome studio. Not studio. What would you call this, Lenny? Dr. Lenny?
Wellness Center?
Awesome Wellness Center. And you can come here too. We're over here on Ridge Avenue, and this dude is the man. You've seen my updates on Facebook and Snapchat and Instagram, getting my King Day. So you come on down here. What's the address, Lenny?
8151 Ridge.
8151 Ridge. Keeping good company. Thanks a lot, Lenny.
Sure, appreciate it.
Yes, sir.